Okay, let's dive right in to this tricky situation, right? You're in the ER and you're feeling dizzy. You've got that awful spinning sensation, vertigo. But how can you tell if it's just an inner ear thing or something much more serious like a stroke?
That's a really crucial distinction to make, and missing a stroke can have some, really serious consequences.
Absolutely. So we're going to explore two tools that doctors use to make that call, the HINTS exam and the Triage Plus score.
Right, those are really valuable tools for emergency medicine, kind of like having extra sets of eyes to help figure out what's really going on.
Okay, so first up, the HINTS exam.
Mm.
Um, it sounds kind of straightforward, like hints, clues.
Yeah, well, it's actually an acronym. It stands for Head Impulse Nystagmus Test of Skew. So
Yeah.
basically a three-part test for your eyes.
A detective test for your eyes. Interesting. So let's break that down. What's the head impulse part all about?
So imagine the doctor quickly turns your head to the side while you're focusing on a fixed point, right in a normal reaction. Your eyes should stay locked on that target. But if they have to dart back to refocus, that can indicate an inner ear problem. But if they stay fixed, that's when things get a little more concerning potentially.
So it's like checking your eye reflexes. That's pretty cool. And what about this nystagmus test?
Have you ever noticed someone's eyes kind of jerking back and forth involuntarily? That's called nystagmus now with an inner ear issue. That jerking usually goes in one direction, but with a stroke, it might swish directions, like depending on where you're looking.
Okay. Subtle but important. I see. And the test of skew. What's that one all about?
That one's pretty simple. The doctor shines a light in your eyes and sees if one eye appears higher than the other. If they're not aligned, that could be another sign pointing towards a stroke.
Wow, this hints exam. It's like a secret code for doctors to figure out what's happening in your brain. But it sounds like you need a real expert to do it properly.
Absolutely, you're right. A properly performed HINTS exam is incredibly accurate, even more so than an early MRI in some cases. But yeah, it does require specific training. Misinterpreting those subtle eye movements could mean missing a stroke, and we definitely don't want that.
So hints is a powerful tool, but only in the right hands. Now, what about the Triage Plus score? Is that more of a quick check?
Yeah, you could say that. Think of it like a checklist of risk factors, and each one adds points to your score. The higher the score, the higher the chance of a stroke.
Okay, so let's hear those risk factors. What should we be paying attention to?
Age is a big one. 65 or older, that's 2 points right off the bat. And then high blood pressure, 140 over 90 or higher. That's another point.
So if you're over 65 with high blood pressure, you're already at 3 points. What else adds to the score?
Things like headaches, vomiting, neck pain, those can add 2 points. Having trouble walking steady, that's another point. And if you have a history of stroke or vascular disease, add another point to the total.
Okay, so how many points do we need to really start worrying?
10 or more is a major red flag. That means there's a very high chance, like 96%, that you're dealing with a stroke.
Wow, that's pretty accurate, but can you rely on the score alone?
Well, here's the thing. It's great at catching those high probability strokes, but it's not as good at ruling them out if you have a lower score. There's still a chance it could be a stroke even with a lower score.
So Triage Plus is more like a first alert system,
Yeah.
especially in a busy ER where they might not have a hints expert available right away.
Yeah, exactly. It helps to prioritize who needs immediate attention.
Okay, so Triage Plus is not a replacement for hints, but it's a good backup, especially if you can't get that hints exam right away.
Mm.
I've also heard about the ABCD2 score, which is used for stroke risk. Why isn't that as useful for vertigo cases?
The ABCD2 score focuses on things like weakness in your arms or legs, which are common in a lot of strokes. But when the stroke affects the back of the brain, the cerebellum, which controls balance, you might not see those typical weakness signs.
So it could give you a false sense of security thinking you're okay because the ABCD2 score is low, but actually the problem is in a different part of the brain.
Exactly. That's why HINTS and Triage Plus are so important. They kind of work together. HINTS is really good for ruling out a stroke, while Triage Plus helps to rule it in.
This is all starting to make sense. So you're in the ER feeling dizzy. Ideally, a doctor trained in hints can do that exam. But if not, Triage Plus can help flag those who need a closer look, even if their symptoms don't seem too bad.
That's a great summary. And remember, even with a clear HINTS result, an MRI is still essential to confirm there's always a small chance, about 3 to 5%, that a stroke could be missed.
Better safe than sorry, especially when it comes to something as serious as a stroke. Now, let's see how this works in a real-world case. Say we have a 70-year-old patient who comes in with vertigo, blood pressure is a bit high at 150 over 95, and they're having trouble walking steadily.
Okay, so right away, we've got some Triage Plus points their age, and blood pressure alone puts them at 3 points.
And the unsteady gait adds another point, bringing this total to 4, not quite at that alarming 10 or above, but definitely something to pay attention to. So what happens next? Do we go straight to an MRI?
This is where the HINTS exam comes in. Let's say the doctor does the exam and they find a normal head impulse test. But the nystagmus is changing direction. What does that tell us?
Well, we learned that changing direction with nystagmus is a big red flag for a potential stroke, right?
Exactly. Even though the TriAGE plus score isn't super high, the HINTS exam is giving us a clear warning. So what do we do next?
Time for that MRI to confirm what's going on.
You got it. And let's say the MRI shows a cerebellar stroke. This really shows how important the HINTS exam can be, especially when the TriAGE plus score isn't so clear-cut.
So the takeaway here is to trust the HINTS exam when it's available, even if the score isn't screaming stroke.
Absolutely. It's the gold standard for evaluating vertigo and potential stroke, of course. TriAGE Plus is still a helpful tool, especially when you don't have a HINTS expert readily available. This has been a great deep dive so far, but I'm wondering, we've been talking about the ER, but how can these tools be used in primary care settings? Could they help catch strokes earlier, even before someone ends up in the ER?
Yeah, that's a really important point because not everyone with vertigo rushes to the ER right away.
That's true. And catching a stroke early is so crucial.
Absolutely. But it sounds like there are some challenges when it comes to using these tools in primary care.
Yeah, for sure. I mean, one big hurdle is training. Not every primary care doctor has the same level of expertise in neurology as, say, an ER doctor or a neurologist. Doing the HINTS exam correctly takes a lot of practice and a deep understanding of those subtle eye movements.
Like, because we talked about how even small misinterpretations could have big consequences.
Exactly. And then there's the time factor. Primary care appointments are often pretty short, so squeezing in a detailed neurological exam like HINTS can be tough.
Yeah, I can see that. And let's be real. Most people aren't going to their doctor for vertigo specifically.
Yeah.
Right? It might be just one symptom among many that the doctor is trying to deal with.
Absolutely. So while it would be great if every doctor was a HINTS expert, the reality is a bit more complicated.
So are we stuck? Is there any way to bridge this gap and bring these life-saving tools to primary care?
Well, there are some really promising possibilities. Things like telemedicine could play a huge role. Imagine a patient with vertigo having a virtual visit with a neurologist. The specialist could guide the primary care doctor through the HINTS exam remotely.
That's a brilliant idea. It's like having a neurologist on call, even in places where it's hard to find specialists. Are there any other solutions being looked at?
Yeah, definitely. Researchers are also working on special decision support tools to help primary care doctors assess stroke risk based on the patient's symptoms and medical history. They could even combine elements of both HINTS and TriAGE, plus in a simpler, more user-friendly way.
So kind of like an app that helps guide the decision-making, even if the doctor isn't a HINTS expert themselves.
Precisely. It could flag high-risk patients who need to see a specialist right away, potentially speeding up diagnosis and treatment by a lot.
This is all sounding really positive.
Mm.
It seems like we're on the edge of a major shift in how we approach vertigo and stroke detection.
I think so too. There's a growing recognition that we can't just focus on treating symptoms. We need to find the root cause, and that means empowering primary care doctors to make those crucial distinctions early on.
It's not just about specialists anymore. It's about a system where every doctor can spot those red flags and take action.
Exactly. It's about collaboration and knowledge sharing, leading to better outcomes for patients. We've been focused on the medical side, but it's important to remember the patient's role too.
Absolutely. Knowledge is power. The more people understand about vertigo and stroke, the better they'll be able to advocate for themselves and get help when they need it.
So true. Just knowing the signs of a stroke and realizing that vertigo isn't always harmless could save lives. And don't underestimate the power of communication. Encourage patients to be open with their doctors, even if they're worried about overreacting.
Always better to err on the side of caution when it comes to potential brain issues.
Couldn't agree more. If something feels off, like the dizziness is different or there are other worrying symptoms, don't wait to get medical help. Time is brain when it comes to stroke.
This has been so insightful, but I'm curious, with all this talk about HINTS and TriAGE, plus, is there any research going on to make these tools even better? What's next for vertigo and stroke assessment?
Great question, and the answer is yes. Researchers are constantly working on refining these tools to make them even more sensitive and specific.
So better at picking up on those subtle signs and reducing the chances of missing a stroke or raising a false alarm.
Exactly. And there's a lot of excitement about developing totally new diagnostic approaches. For instance, using AI to analyze eye movements and detect tiny abnormalities that a human might miss.
Wow, AI for stroke detection, that sounds pretty futuristic.
It is, and it has the potential to revolutionize how we diagnose and treat stroke. Imagine an app on your phone that can analyze your eye movements and assess your stroke risk with incredible accuracy.
That's amazing. And think about how accessible that would be for everyone, no matter where they live or if they have access to specialists.
Exactly. The possibilities are really exciting. But even with all these advancements, the main message remains the same: awareness. Early detection and quick intervention are key.
It sounds like the future of stroke detection and treatment is very bright. But before we go too far, let's recap what we've learned so far and wrap things up in part 3. Okay, so we've talked a lot about the HINTS exam and the TriAGE plus score and even the potential of AI in stroke detection. But let's bring it back to the listener. What should you actually do if you're experiencing vertigo?
That's the million-dollar question. First of all, don't freak out. Vertigo is a super common thing, and a lot of times it's totally benign and treatable.
But like we've discussed, it can also be a sign of something much worse, like a stroke. How can you tell when it's time to really worry?
It's all about listening to your body and paying attention to what else is going on. If the dizziness is really bad or it doesn't go away or it just feels different than usual, then yeah, it's time to get checked out by a doctor.
Okay, so what are some of those red flags that should make you head straight to the doctor?
Well, we've mentioned a few already, like if the vertigo comes on suddenly, especially if it's accompanied by a headache, vomiting, or neck pain, that's a big one. Also, problems with walking, slurred speech changes, in your vision weakness or numbness on one side of the body. Those are all classic stroke symptoms, and you need to get medical attention immediately.
And what if you don't have those obvious signs, but the vertigo is just lingering and not getting any better? Is it still worth seeing a doctor?
Absolutely. You know your body better than anyone. It's always better to be safe than sorry when it comes to anything neurological. A doctor can evaluate your individual case, look at your medical history, and help you decide what to do.
So it's not about running to the ER every time you feel a little dizzy, but being aware and knowing when to seek help.
Exactly. The more you know about vertigo and how it can be connected to stroke, the better prepared you are to take care of your health.
This deep dive has been so informative. It's amazing how something as ordinary as dizziness can have such complex implications.
Mhm.
But with these tools like the HINTS exam and the TriAGE Plus score, we're becoming much better at identifying those subtle stroke signs and getting people the treatment they need quickly.
I totally agree. And with all the exciting research and new technologies being developed, the future of stroke detection and treatment is looking really promising.
We've explored so much today, but there's always more to discover. If you're interested in learning more about vertigo stroke or the latest developments in neurological care, we encourage you to check out those resources you gave us. And remember, your health is your most valuable asset. Don't hesitate to ask questions, advocate for yourself, and get the care you deserve.
Well said. And until next time, stay curious, stay informed, and stay well.
That's all for today's deep dive. Thanks for listening.